Hi. Hi, welcome to our Pharma Topics channel, which aims at simplifying the pharmacy subjects and to aid the students who are preparing for GPAT examinations. Today, our topic of discussion is drugs of choice. There are many drugs which are available for different indications. Let us see the best drugs of choice for a particular indication. The first one is shock. It may be anaphylactic, cardiogenic with uric renal failure or shock due to adrenal insufficiency. For anaphylactic shock, the best drug is the drug of choice is adrenaline. For cardiogenic shock, it is noradrenaline. In case of cardiogenic shock with renal failure, it is dopamine. And shock due to adrenal insufficiency, corticosteroids are the drug of choice. The vasopressor of choice in pregnancy is ephedrine. For mushroom poisoning, it is atropine. And for postural hypotension, which happens with the antihypertensive drugs, the drug of choice is fludrocortisone. And for pheochromocytoma, the drug of choice is phenoxybenzamine. In case of refraction testing, in case of adults, the drug of choice is tropicamide. In case of children for refraction testing, it is atropine. For fundoscopy examination, the drug of choice is phenylephrine. For glaucoma, in case of open angle glaucoma, the drug of choice is latanoprost, and for angle closure glaucoma, it is acetazolamide. And for opioid-induced constipation, it is naltrexone. For diarrhea in carcinoid syndrome, the drug of choice is octreotide. For myasthenia gravis, the drug of choice for diagnosis is hydrophonium. For treatment of myasthenia gravis, the drug of choice is pyridostigmine. For poisoning with belladonna, datura, or atropine poisoning, the drug of choice is physostigmine. For hepatic encephalopathy, the drug of choice is lactulose. For rebound hypertension due to clonidine withdrawal, the drug of choice is phentolamine. In case if it is not available, tolazolin. And for benign prostate hyperplasia, it is tamsulosin. For hypertensive emergencies, the drug of choice is nicardipine or clevidipine, the calcium channel blockers. Previously, sodium nitroprusside was the drug of choice. Nowadays, it is not preferred. For hypertension in pregnancy, it is methyldopa. And for Raynaud's syndrome, the drug of choice is calcium channel blockers. For essential tremors, akathisia, and hyperobstructive cardiomyopathy, it is propranolol. For beta blocker poisoning, the drug of choice is glucagon. For migraine treatment, the acute severe attacks, the drug of choice is sumatriptan, and for prophylaxis of migraine, the drug of choice is propranolol. For patent ductus arteriosus, to maintain the patency, alprostadil is the drug of choice, and for treatment of the disclosure of patent ductus arteriosus, the drug of choice is indomethacin. For abortion less than 7 weeks, the drug of choice is mifepristone in combination with misoprostol. For induction of labor and prevention of postpartum hemorrhage, oxytocin is the drug of choice. For erectile dysfunction, the drug of choice is sildenafil, the PDE5 inhibitors. For gout, acute cases, the drug of choice is NSAIDs. For chronic cases, the drug of choice is allopurinol. For chronic cases, if allopurinol is allergic to the patient, then the drug of choice is febuxostat. And for refractory cases of gout, the drug of choice is colchicine. For diabetic nephropathy and scleroderma hypertensive crisis, ACE inhibitors are the drug of choice. For pulmonary hypertension, bosentan is the drug of choice. In case of hypertensive emergency, we have seen nifedipine and clevidipine are the drugs of choice. In esophageal spasm, the drug of choice is nitroglycerin. For type 2A, 2B hyperlipidemia and type 4 hyperlipidemia, where the cholesterol levels are high, and in case of hypercholesterolemia secondary to nephrotic syndrome, the statins are the drugs of choice. For type 3 hypertriglyceridemia, where the triglyceride levels are higher, the drugs of choice are fibrates. For heart failure, in case of decompensated heart failure, the drugs of choice are dobutamine. In case of compensated heart failure, the drug of choice is ACE inhibitors and angiotensin receptor blockers. And hyperobstructive cardiomyopathy, the drug of choice is propranolol. In cyanide poisoning, the drug of choice is amyl nitrate. In supraventricular tachycardia with a narrow QRS, the drug of choice is verapamil. When there is wide QRS in case of SVT, the drug of choice is flecainide. Flecainide is also the drug of choice for Wolff-Parkinson-White syndrome. In digitalis induced post-myocardial infarction, the drug of choice is lignocaine. For torsitis D-pointus, the drug of choice is magnesium sulfate. And in case of syndrome of inappropriate antidiuretic hormone secretion, the drug of choice is fluid restriction with hypertonic saline and along with furosemide. In acute hyperkalemia, the drug of choice is calcium gluconate. In diabetes insipidus, the drug of choice is desmopressin in case of central diabetes insipidus, that is nocturnal enuresis. In case of nephrogenic diabetes insipidus, the drug of choice is thiazides. In case of lithium-induced diabetes insipidus, the drug of choice is acetazolamide. In hyperglycemia, in case of diabetic ketoacidosis, regular insulin is the drug of choice. In case of postprandial glucose increase, the drug of choice is nataglinide. In thyroid disorders, in case of hyperthyroidism, the drug of choice is carbimazole. In hyperthyroidism, in case of pregnancy first trimester and lactation, it is propylthiouracil. Hyperthyroidism in second trimester onwards, carbimazole is the drug of choice. Hyperthyroidism with Graves' ophthalmopathy, methylprednisolone is the drug of choice. In case of hyperthyroidism with thyroid storm, propranolol is a life-saving drug of choice along with propylthiouracil. In hypothyroidism, the drug of choice is levothyroxine. In case of myxedema coma, extreme hypothyroidism, the drug of choice is leothyronine. In case of edema, congestive heart failure with edema, the drug of choice is furosemide. In case of cerebral edema, the drug of choice is mannitol. And in case of hepatic cirrhosis with edema, the drug of choice is aldosterone antagonist spironolactone. In case of angina, for prophylaxis, the drug of choice are oral or transdermal nitroglycerin. In case of acute attacks of angina, it is sublingual nitroglycerin, the drug of choice. In case of Addison's disease, the drug of choice is hydrocortisone. In case of anovulatory infertility, the drug of choice is clomiphene. In case of tetany, calcium injection is the drug of choice. In case of acromegaly or hyperprolactinemia, the drug of choice is cabergoline. In case of endometriosis, the drug of choice is oral contraceptive pills. In case of ectopic pregnancy, the drug of choice is methotrexate. In case of osteoporosis, for postmenopausal steroid-induced or Paget's disease, the drug of choice is bisphosphonates, that is alendronate. In osteoporosis with women who have the increased risk of breast cancer, raloxifene is the drug of choice. For dysfunctional uterine bleeding, which is light or less, the drug of choice is medroxyprogesterone acetate. For dysfunctional uterine bleeding, heavy bleeding, oral contraceptive pills are the drugs of choice. And for intractable dysfunctional uterine bleeding, the drug of choice is leuprolide. In case of esophageal varices, terlipressin is the drug of choice. If it is not available, octreotide can be used. In case of anxiety, but that is related to performance, the drug of choice is propranolol. In case of insomnia, the drug of choice is zolpidem, and in case of narcolepsy, the drug of choice is tiprolicent, which is a H3 agonist. In case of contraception for newly married couples, the drug of choice is oral contraceptive pills. Contraception in case of lactation, the drug of choice is mini pills, that is progesterone only pills. And for emergency contraception, the drug of choice is levonorgestrel. In case of generalized anxiety disorder, for acute cases, the drug of choice is benzodiazepines. For sustained treatment of generalized anxiety disorders, the drug of choice is venlafaxine. In case of alcohol withdrawal with seizures, the drug of choice is benzodiazepines. In case of alcohol maintenance therapy, the drug of choice is chlorodiazepoxide. To reduce the craving in alcohol withdrawal, the drug of choice is naltrexone. And in case of methanol or ethylene glycol poisoning, the drug of choice is fomepizole. And in trigeminal neuralgia, the drug of choice is carbamazepine. For post-herpetic neuralgia, the drug of choice is pregabalin. The drug of choice for epilepsy cases is as follows. For grand mal epilepsy, it is valproate, and for petit mal epilepsy, that is absent seizures also, the valproate is the drug of choice. For focal seizures, myoclonic or atonic seizures, carbamazepine is the drug of choice. For status epilepticus, diazepam is the drug of choice. For epilepsy in case of pregnancy, lamotrigine, topiramate or levetiracetam is the drug of choice. And for Lennox-Gastaut syndrome, the drug of choice is valproate or rufinamide or clonazepam. For eclampsia-related seizures, the drug of choice is magnesium sulfate. For coccidomycosis, the drug of choice is amphotericin B. For paracoccidomycosis, itraconazole is the drug of choice. For panic disorders, for acute treatment, it is benzodiazepines. For sustained treatment of panic disorders, selective serotonin reuptake inhibitors such as sertraline are the drug of choice. For schizophrenia, general cases, it is olanzapine. For non-compliant cases of schizophrenia, risperidone long-acting injections are the drug of choice. And clozapine is the drug of choice for refractory schizophrenia cases. For Gilla-D-Tourette syndrome, the drug of choice is haloperidol. For Huntington's disease or tic disorders, tetrabenazine is the drug of choice. Parkinsonism or for restless leg syndrome, the drugs of choice are pramipexole and ropinirole. For drug-induced Parkinsonism, anticholinergics like benzexol are the drugs of choice. For mania, acute cases, the drugs of choice are olanzapine along with lithium. For prophylaxis and bipolar disorders of mania, the drug of choice is lithium. For Wilson's disease, the drug of choice is zinc. For muscle relaxants in case of asthma, the drugs of choice are vecuronium. For muscle relaxant in case of renal or hepatic disease, atracurium or cisatracurium is the drug of choice because it gets easily eliminated. For endotracheal intubation, succinylcholine is the drug of choice. For obsessive compulsive disorder and bulimia, selective serotonin reuptake inhibitors such as fluoxetine is the drug of choice. For severe cancer pain and severe myocardial infarction pain, morphine is the drug of choice. In case of neuroleptic analgesia, the drug of choice is droperidol with fentanyl. For neuroleptic anesthesia, the drug of choice is droperidol with fentanyl and nitric oxide. For neuroleptic malignant syndrome, the drug of choice is dantrolene. For lepra reactions, the drug of choice for type 1 and type 2 is corticosteroids. For amyotrophic lateral sclerosis, riluzole is the drug of choice. For asthma attacks, acute attacks, and in case of pregnancy asthma, salbutamol is the drug of choice. During labor and patients on beta blockers, the drug of choice is anticholinergic cipratropium. And aspirin-induced asthma, the drug of choice is corticosteroids. For brittle asthma, that is severe asthma, for type 1 brittle asthma, the drug of choice is terbutaline subcutaneous injection. And for type 2 brittle asthma, adrenaline subcutaneous is the drug of choice. In case of general anesthesia, for asthmatic patients and patients with shock, ketamine is the drug of choice. For controlled hypotension and for cardiac surgery, inhalation isoflurane is the drug of choice. For induction of cardiac surgery, etomidate is the drug of choice. And propofol is the general anesthetic of choice in trachea surgery and malignant hyperthermia. For warfarin overdose, vitamin K is the drug of choice. To treat fibrinolytic overdose, tranexamic acid or epsilon aminocaproic acid are the drugs of choice. For vomiting, in case of migraine induced, it is metoclopramide. For motion sickness, the drug of choice is hyoscine. For pregnancy or morning sickness, the drug of choice is doxylamine plus atropine. For chemotherapy induced emesis, that is acute cases, are treated with 5-HT3 antagonists such as ondansetron. For chemotherapy induced delayed emesis that occurs after 3 to 5 days, the drug of choice is neurokinin antagonist such as aprepitant. For chemotherapy induced leukopenia, the drug of choice is sargramostim. For heparin induced thrombocytopenia, the drug of choice is argatroban. For Zollinger-Ellison syndrome, the drug of choice is proton pump inhibitors. Thrombocytopenia may be due to chemotherapy. The drug of choice is oprelvecin. For Candida infections, in case of Candida albicans, the drug of choice is fluconazole. For Candida glabrata and Candida krusei, the drug of choice is capsofungin. For Mycobacterium avium intracellular complex, the drug of choice is azithromycin plus ethambutol plus rifampicin. For Mycobacterium canasi, the drug of choice is INH, isoniazid plus rifampicin and ethambutol. For Mycobacterium fortium, the drug of choice is cefoxitin plus clarithromycin. For blastomycosis, mild non-CNS infections, fungal infections, itraconazole is the drug of choice. For severe CNS blastomycosis infections, amphotericin is the drug of choice. For mucormycosis, the drug of choice is amphotericin B. For invasive aspergillosis, the drug of choice is voriconazole. For herpes simplex virus, the drug of choice is acyclovir. For Bell's palsy, the drug of choice is corticosteroids. For measles, Lassa virus, Rift Valley virus or Hantan virus, the drug of choice is ribavirin. For amoebiasis, in case of asymptomatic intestinal infections, diloxanide furovate is the drug of choice. For extraintestinal amoebiasis, the drug of choice is metronidazole along with the diloxanide furovate. For primary amoebic meningococcal encephalitis, the drug of choice is amphotericin B. For prions disease, the drug of choice is flupiritin. For HIV post-exposure prophylaxis or the needle stick injury, the drug of choice is zidovudin plus lamivudin and atazanavir. For respiratory syncytial virus, the drug of choice is palivizumab. For bird flu infections, the drug of choice is oseltamivir. For trematodes, that is tapeworms, the drug of choice for schistosomiasis and Tinea solium or Tinea saginata and H. nana infections, the drug of choice is praziquantel. For neurocysticercosis and echinococcus, the drug of choice is albendazole. And albendazole is the drug of choice for nematodes or roundworm infections, that is for Ascaris, Trichuris, Ankylostoma, Enterobius and Dracunculus. For Wucheria bancrofti and low infections, the drug of choice is diethylcarbamazine. The drug of choice for Onchocerca volvulus or strongyloids infections, it is ivermectin. For Wegener's granulomatosis, cyclophosphamide is the drug of choice. For antiphospholipid syndrome, the drug of choice is warfarin. For malaria in pregnancy, the drug of choice is chloroquine. For pneumocystitis, Jirovecki pneumonia, the drug of choice is cotrimoxazole. For plague, the drug of choice is doxycycline. For whooping cough, the drug of choice is erythromycin. For syphilis, the drug of choice is penicillins. For vancomycin resistant staph aureus, the drug of choice is daptomycin. For hairy cell leukemia, the drug of choice is cladribine. For chronic myeloid leukemia or GAST, that is gastrointestinal stromal disease, the drug of choice is imatinib. For Hodgkin's lymphoma, the combination used is adriamycin, bleomycin, vincristine, and doxorubicin, ABVD. And for non-Hodgkin's lymphoma, the combination is CHOP or cyclophosphamide with procarbazine. And the drug of choice for small cell lung cancer is cisplatin and etoposide. For head and neck cancer and esophageal cancer, the drug of choice is cisplatin with 5-fluorouracil. The drug of choice for osteosarcoma is cisplatin with doxorubicin. For breast cancer, the drug of choice for prevention is tamoxifen. For choriocarcinoma, the drug of choice is methotrexate. For kidney cell carcinoma, the drug of choice is sunitinib. For hepatocellular carcinoma, the drug of choice is sorafenib. For Kaposi sarcoma, the drug of choice is liposomal doxorubicin. And for melanoma, for BRAF infections, it is vemurafenib. And for non-BRAF infections, it is nivolumab. Uh, I hope I have given a nutshell of the entire pharmacological drugs with their drugs of choice, which will be useful for your GPAT examinations. Thank you for listening. Happy learning. Kindly share this to your friends. Kindly encourage us by subscribing to our Pharma Topics channel. For adrenal sarcoma, it is mitotane. So thank you for listening. Subscribe to our channel to get more updates.